Hey guys, this is Jeff Lewis from Lewis Physical Therapy and Sports Rehab in Point Pleasant, New Jersey. I want to talk to you today about injections for baseball players. And for the sake of this video, when we talk about injections, we're talking about corticosteroid injections, PRP, stem cell, really any type of injection that is potentially used or discussed during the healing process. So the first question is, when are injections warranted? And a lot of times with injections, they're usually warranted when there is a lot of inflammation going on after an injury. So to the point where if a guy is really flared up, really inflamed, they really can't even tolerate, certainly can't tolerate throwing, but can't really tolerate much else, even from a rehab standpoint, that might be the right time that an injection is warranted or administered by a physician to that player. Now, I will say overall, though, most of the time, especially in the younger guys that I see, the high school, sometimes the collegiate, usually injections are not needed. A lot of times, it just comes down to letting the body heal, letting an initial rest period take place, and then we build up from there. A lot of times, the biggest issue that I see with the topic of injections in our practice is that a lot of guys will think, all right, I'm hurt. Let me go get an injection real quick, and I'll be back out the next day or the next 2 days and go from there. That is not the case and absolutely should not be the case. If you have an injection, there's a period of a couple of days where you need to be shut down totally from throwing or any type of baseball activity. And the reason being is you want to let the medication do its work. So if you get an injection, just know you're going to have to be shut down for some time. So the goal after injection then is we let the medication do its thing, and then we gradually work on building back up to throwing. It's going to differ for each injury, no doubt about it. But let's just take someone that has some type of inflamed bursa or biceps tendon issue. They get an injection, we're probably looking at 3 to 4 days of them not doing anything, a couple days of some light rehab. Then we want to make sure they do some med ball work without issues. So we're probably looking at they're getting ready to throw probably around the 10 to 14 day after an injection. So again, you're not just getting right back into it. But I will say as a whole, especially in the younger guys, most of the time an injection is not needed. They just need to hold off on throwing for some time, let some rest take over, and then we work on building that up. The last thing I want to touch about injections are they are just a band-aid. A lot of times guys will get injections and be like, oh, my pain is totally gone from an injection. I'm good. This isn't going to happen again. I can go out and play without any worries. Wrong. If you get an injection, all it is doing is serving as a band-aid. It's just covering up the pain and inflammation. You haven't addressed the issue as to why you are having pain or inflammation. So again, the biggest part of our evaluation at first is finding out, okay, why are you inflamed in the front of your shoulder, the back of your shoulder, and your rotator cuff? What is the reason being? Is there something musculoskeletal wise? Is it due to a pitching mechanic? And that's where we, in that case, would rope in a qualified pitching coach to make sure we get their trained set of eyes on that. So again, the overarching theme here for injections are they needed sometimes to get over that hump and get a little more to be able to tolerate some rehab? Yes, absolutely. But as a whole, from what I've seen in our practice, injections are not warranted, and they're usually mistreated or misguided in the sense of guys think I get an injection and okay, I'm back to play right now. So if you are a pitcher or baseball player that has been told you need an injection, you're dealing with some pain, and that's an option on the table, and you're really not sure about how you want to pursue forward with this, feel free to go ahead and subscribe, like our channel, leave a comment below with any questions you have.